So, acute pain. Let's talk about an acute pain problem where you say, slam your thumb in the door, or you stub your toe, or you do some form of minor acute tissue damage. So when you slam your thumb in the door, what happens is that the door crushes your thumb and there's tissue damage. There's the cells that are making up your thumb. Some of them get damaged. They spill the contents from the inside of the cell to the outside of the cell. And all of that damage activates chemical receptors in your thumb, pressure receptors and naked pain receptors, which all collect their information together, and they pass up nerves that run very quickly up your arm into your neck. And essentially there are two types of nerves that transfer that information. There's a insulated, we call it myelin, that's the fatty sheath around the nerve, myelinated fibers that run quickly. And then there are slow, uninsulated fibers that transfer a slower signal in. More of that later. These signals come into your neck, and then they are integrated into your spinal cord in a junction in your spinal cord where things can get manipulated. And then they project forward into your brain through centers like the thalamus, a map of your body, and other integrating centers. They eventually reach the front of your brain, your prefrontal cortex, and they are integrated into most people who have normal sense of vision, the visual input. And so as you look at your thumb and you think, my, that's going to hurt, as that enters your consciousness and the T of hurt goes through your consciousness, the pain hits you and you've got a very, very uncomfortable thumb. Ouch. Okay. And then that pushes information through your brain, down into your brainstem and out through a thing called the automatic or autonomic nervous system. So the autonomic nervous system is a one-way system that runs from the brainstem and the spinal cord to your heart, to your lungs, to your adrenal glands, to your kidneys, to your skeletal muscle, to your skin, and to your bowel. And it's a command and control system. So it makes you sweaty, it makes you anxious, it makes you nauseous, it gives you a dry mouth, it diverts blood from your bowels to your skeletal muscle to get you to run away, it dilates up your pupils, it enhances your sense of smell, it makes you focus on the thing that's caused you the pain, in which case this was the door and the thumb, and it gets you to run away. It's known as the flight or fight system. Okay, now you've got your pain from your thumb, you've activated your nervous system, you've got a heightened heart rate, you've got some churning in your tummy because of the autonomic nervous system, you're releasing lots of adrenaline, your skin's gone pale and your blood flow's gone to your skeletal muscle system. That's what happens. Okay, and then after that's passed and you've had this dry mouth and you've had this increased sense of smell and taste and vision, you just feel exhausted afterwards. And that is a feeling I think that many people with fibromyalgia experience. The stimulation of your organs, of your muscles, of your skin sends signals back up your spinal cord, which then in the acute pain pathway, you understand, you know why that's happened. But in chronic pain, those feelings, the churning in your stomach, the muscle blood flow, the proprioception, the joint movement, all of the feelings that are coming back up your spinal cord get misinterpreted by your brain as pain signals. And that's the key change between acute and chronic. That the signals that you're getting in chronic pain aren't a sign of damage. They're not a sign that your thumb's been injured, but they are a summation of all of the other feelings that the autonomic nervous system, when it's pushed and triggered, spill out into your body. And over time, you get this circling of stimulation and outflow, which doesn't then need an acute pain signal to drive. And that's what happens as you transition from an acute pain experience to a chronic pain experience.